morning, everyone. I'm Marie-France Hivert. I am the chair of the program committee for this year Epi Lifestyle Conference here in Boston. And our main theme this year was implementation science. And we had the pleasure to hear three outstanding keynote speakers, including Dr. Cené here, who is also a senior co-author of the implementation science statement that was published in fall 2022. Dr. Cené, tell us a little bit about yourself. Sure. And summarize to the audience who didn't have the chance to be here what is implementation science and why do we need it to improve cardiovascular health?
So I'm Cené. I'm a physician. I'm a general internal medicine doctor. I'm a health services and health equity researcher. I am an implementation scientist, and I'm currently at UC San Diego Health and UC San Diego School of Medicine. So I was really excited to talk about implementation science. This is a very important area, which is really focused on, it's sort of the scientific study of factors and strategies that help us to implement things that we know we should do, evidence-based practices, whether they are programs, policies, or interventions. It helps us to figure out how do we make sure we do the things that we know that we should do. Many of you who are watching this know that we often don't do interventions and approaches that are recommended based on the evidence. And so implementation really helps us to figure out why is it, what are the barriers to doing the things that we actually know work. In addition to that, it's also focused on helping us to not do things that don't work. So there is a field within implementation science that's really focused on de-implementation, or the study of ways to get people to stop doing practices that are ineffective. Within this field, you'll hear a lot about the distinction between dissemination science and implementation science, so I'll touch on that very briefly. I like to think of this pretty simplistically as the difference between getting evidence-based practices out, so getting them widely adopted, or understanding the factors that help to get widespread adoption or uptake of evidence-based practices. So that's dissemination science, versus implementation science is really focused on getting evidence-based practice in or integrated into the settings in which we want to implement them. So it's really that getting out versus getting in, and studying the best approaches to being able to do that. So just as an example, let's say that we wanted to take the evidence around screening for food insecurity. If a dissemination science approach may say, what are the best strategies for being able to get that widely adopted so that people know, or communities or practices or health systems know that they should be implementing screening for food insecurity? That would be a dissemination science question. Implementation science may help us to say, okay, if I want to screen within my own clinic or within my health system, what are the optimal strategies for being able to do that? So it's kind of this disseminating out widely, or getting information out about evidence-based practices widely, versus figuring out and studying how do I get that done or integrated into a specific setting.
That is super helpful, and your examples were stellar. Can you tell us a little about the theory or the frameworks that implementation science are usually relying on?
Yes, so this is a big question, because one of the interesting things about implementation science is that it is very important to use theories and frameworks in conducting this line of research. But we know that there are over 170 actually, different theories or frameworks. So it's a lot. Interestingly, a lot of those, or a growing number of them, are focused on health equity, which is really important, because with implementation science, we're also trying to think about how do we move the needle to increase adoption and speed up the translation between what we know works and what we do. But back to the theories, because there are so many of them and it's important to use, we generally recommend, pick one or two that you get very familiar with and understand, and use them to help guide your work. There are all different types of theories. I won't go into all of the specifics, but it is important in this area of research to actually use a theory to help guide your research.
And if you had one takeaway message for our audience, what would that be?
I would say implementation science is a really powerful tool for bridging that gap between what we know and what actually gets done in practice. It answers very specific questions, right? It's designed not to answer the question of, does this evidence-based practice, whether that's an intervention, a policy, a practice, does that work? That's what our effectiveness and efficacy studies are designed to do, to answer that question, does this thing work to affect the outcomes that we care about? Implementation science is starting from the standpoint of, we know this works, this evidence-based practice works in a particular population or setting, but we're trying to figure out what are the one or two key behaviors that need to be targeted, and the barriers and facilitators to those behaviors understood in order for people to actually do the thing, right? To get it done. And so I would say, with implementation science, the key take home is understanding that you start from the perspective of evidence for an evidence-based practice that's already shown to be effective. That's where you start. I will say that one other key point is that a lot of people will say, well, I'm kind of at the point where I need to still build a little bit more evidence. So for example, maybe there are studies or trials that have been conducted in populations we know they work to affect outcomes, but maybe they weren't done or maybe patients who are minoritized racial and ethnic groups were underrepresented in those trials. Well, we may need to find a little bit more evidence in that case that intervention actually worked to that population. So that's where this hybrid implementation effectiveness trials come into play. So I think those are great because you can look at effectiveness outcomes, typical kind of individual level outcomes that we often look at in effectiveness studies, but also you can look at implementation outcomes such as adoption, acceptability, cost, which are a really important driver, sustainability. So I think the hybrid studies are really the best of both worlds, and it's a way that many researchers, whether you're junior or more senior, can really take advantage of this wonderful resource and tool that is implementation science.
Well, thank you so much for your time. Thank you for your wonderful talk today. And I invite everybody to go look at the AHA statement that is available for all.
Yes, thank you for having me.